It's one of the most talked about pills in the world. Some call it a miracle for men. Others think it's just for performance behind closed doors. But here's the real question. Do you actually know what Tadalafil is really used for and what it might be doing to your body? Because what you've heard so far is only part of the truth. In this video, we're going to break down what Tadalafil really is, how it works in your body, its approved uses, off-label uses, and even emerging research. Plus, who should and shouldn't be taking it. And here's the twist. In Chapter 6, you'll discover a little-known fact about Tadalafil use in women and the studies that might change the way we think about this drug entirely. Let's dive in. Tadalafil is a medication that belongs to a class of drugs known as PDE5 inhibitors, the same family as sildenafil, Viagra. But while they're similar, Tadalafil has some unique features that make it different, and in many ways, more versatile. How it works. Inside your body, there's an enzyme called phosphodiesterase type 5, PDE5. Its job is to break down a substance that helps relax blood vessels. Tadalafil blocks this enzyme, which allows your blood vessels to stay open longer, improving blood flow, especially to the genital area, the bladder and prostate, and in some cases, even the lungs and brain. The result? Better blood circulation, easier muscle relaxation in targeted areas, a longer-lasting effect compared to other drugs in its class. What makes Tadalafil different? Unlike sildenafil, which lasts about 4 to 6 hours, Tadalafil can last up to 36 hours. That's why it's often called the weekend pill. It's also available in as-needed doses, 10 mg or 20 mg, daily low-dose regimens, 2.5 mg or 5 mg. This flexibility makes it useful for both immediate effects and long-term therapeutic purposes. Pattern break. It wasn't created just for sex. Tadalafil was originally studied for vascular conditions including pulmonary hypertension, enlarged prostate, even early-stage heart issues. Its reputation as a performance drug came after it was found to improve blood flow in multiple systems, not just the reproductive one. In the next chapter, we'll explore the most common and well-known use of Tadalafil, treating erectile dysfunction, how it works, why it works, and what to expect. This is what most people associate Tadalafil with, and for good reason. It's one of the most effective, long-lasting treatments available for erectile dysfunction, ED. But how exactly does it help? ED isn't just in your head. Erectile dysfunction happens when blood flow to the penis is restricted, either due to poor circulation, nerve damage, hormonal imbalance, stress, or psychological causes, or a combination of all of the above. Tadalafil doesn't cause arousal or desire. What it does is amplify your body's natural response to arousal by keeping the blood vessels open longer, allowing more blood to enter the penis, less blood to drain out, a more stable, sustained erection when stimulation occurs. Why men prefer Tadalafil. Compared to other ED medications, Tadalafil offers longer duration, up to 36 hours. A more natural window of spontaneity, you don't have to time it. Fewer food or alcohol interactions. The option for daily use, which supports spontaneous intimacy without planning. It becomes part of your lifestyle, not just a reaction to a problem. Who shouldn't use it for ED? Tadalafil isn't for everyone. You should avoid or speak to a doctor before using it if you take nitrates for chest pain, have severe heart or liver conditions, are recovering from a recent stroke or heart attack, have low blood pressure or uncontrolled arrhythmias. Pattern, break, ED may be a symptom, not the problem. Remember, ED is often an early warning sign of vascular disease. So if you're under 50 and need Tadalafil, it may be time for a heart checkup, blood sugar testing, hormonal and lifestyle evaluation. Did you know Tadalafil is FDA approved to treat not only ED, but also benign prostatic hyperplasia, BPH, commonly known as enlarged prostate? This condition affects up to 50% of men over 50, and its symptoms can seriously affect quality of life. Let's explore how Tadalafil helps and why many doctors are prescribing it for more than just performance. What is BPH? Benign prostatic hyperplasia happens when the prostate gland slowly enlarges with age. This can put pressure on the bladder and urethra, leading to frequent urge to urinate, difficulty starting or stopping urination, weak urine stream, getting up multiple times at night, nocturia. It's not cancer, but it can become a chronic, frustrating issue. How Tadalafil helps. Tadalafil relaxes smooth muscle tissue, not just in blood vessels, but also in the bladder, prostate, and urethra. This reduces pressure and improves urine flow by easing tension in the prostate, allowing the bladder to empty more completely, reducing irritation and urgency. Bonus: for men with both BPH and ED, Tadalafil treats both conditions at the same time, which reduces the need for multiple medications. Why this matters most: BPH drugs, like alpha blockers, can cause dizziness, low blood pressure, sexual side effects. Tadalafil, by contrast, often improves sexual function, making it a preferred choice for many men with overlapping symptoms. Pattern break. You may have BPH and not know it. Some men live for years with BPH symptoms, thinking it's just part of getting older, but frequent urination, disrupted sleep, and urgency aren't normal, and they're treatable. If you're using the bathroom more than 8 times a day, or waking up more than once at night, you might benefit from speaking to your doctor about Tadalafil for BPH. When most people think of Tadalafil, they think of intimacy, not circulation. But did you know that this drug was originally studied for heart conditions and pulmonary hypertension? That's because one of its core mechanisms, vasodilation, directly impacts your blood pressure. Let's take a closer look. How it affects blood pressure. Tadalafil relaxes the smooth muscle lining of blood vessels, which causes those vessels to widen, a process called vasodilation. The result? Lower vascular resistance, easier blood flow, and in many cases, a mild drop in blood pressure. This is why Tadalafil is sometimes used in mild hypertension cases and is absolutely contraindicated with drugs like nitrates or alpha blockers. Mixing these can lead to a dangerous sudden drop in blood pressure, dizziness, fainting, or worse. Possible cardiovascular benefits. Some research has suggested that Tadalafil may improve endothelial function, the health of your blood vessel walls, reduce pulmonary artery pressure, decrease inflammation markers associated with cardiovascular disease. In certain patients, these effects may even help improve exercise tolerance, oxygen efficiency, circulatory performance. However, this is not an approved use and self-medication is risky. Warning signs of too much vasodilation. If Tadalafil lowers your blood pressure too much, you might experience lightheadedness when standing, fatigue, dizziness, blurred vision, fainting in extreme cases. If you take blood pressure medication, it's crucial to speak to your doctor before combining it with Tadalafil. Pattern break. It's being tested for heart failure. In recent years, researchers have tested low-dose Tadalafil in patients with early heart failure, aiming to improve vascular tone and oxygenation. Some early results are promising, but larger trials are needed. Until then, it remains experimental, not mainstream. Many people assume Tadalafil is only for erectile dysfunction or prostate issues. But off-label, meaning uses not officially approved, some athletes, biohackers, and clinicians are exploring whether it can help with performance, recovery, and other health goals. Let's dig into what science currently shows, what's speculative, and what risks come with these uses. How might it help performance? Due to its mechanism, PDE5 inhibition, more nitric oxide, vasodilation, Tadalafil can potentially improve blood flow to muscles, which may increase oxygen and nutrient delivery during exercise. This could lead to less fatigue, better endurance. Quickmeds.co.uk +2, Mimit Health +2. Improve exercise capacity in certain pathological conditions, like pulmonary arterial hypertension. For example, trials showed improved 6-minute walking distance and quality of life in patients with pulmonary hypertension using daily Tadalafil. digitalcommons.pcom.edu+11. Possibly improve recovery after intense workouts by reducing buildup of metabolic waste, like lactate, improving blood vessel dilation, thus possibly helping with muscle soreness. Some anecdotal or preliminary reports support this. Valhalla Vitality, +3, Mimit Health, +3, Quickmeds.co, UK +3. What the research actually says. The good and the weak evidence. What's supported? In patients with pulmonary hypertension, tadalafil has been shown to improve exercise tolerance, walking distance, less breathlessness. digitalcommons.pcom.edu+11. Some studies show that in hypoxic or low oxygen conditions or in people with underlying vascular issues, PDE5 inhibitors, like tadalafil, may improve oxygenation and exercise output. quickmeds.co.uk+2 journal.chestnut.org+2. What's weaker or mixed? In healthy athletes under normal oxygen conditions, a study looked at anaerobic performance, Wingate test, with 20 mg tadalafil versus placebo, found little or no effect on most measures such as mean power or fatigue index. Some differences in lactate after recovery and time to reach peak power, but results were modest. PubMed, another study and several reviews point out that many performance metrics don't improve consistently in healthy individuals. quickmeds.co.uk+1. Many reports are anecdotal or from non-peer-reviewed sources. Dosage, timing, and individual variability make a big difference. Risks and caveats of using tadalafil for performance. Using it off-label for performance carries several risks. Side effects, headaches, vision, hearing changes, cardiovascular stress may increase with use, especially in people pushing their physical limits. There may be drug interactions or exacerbation of underlying health issues, heart disease, blood pressure issues, if not monitored. Ethical and legal considerations. In sports, even if a drug is not banned, using it for performance can be controversial. Also, because it's not officially approved for this use, dosage for performance is not standardized, which raises risk of misuse. Pattern break. Real talk insight. Some people report using tadalafil as a pre-workout, taking it before intense training sessions to get better pumps, more endurance. But many of these stories don't control for placebo effect or for overall training, nutrition, rest, all of which matter much more. So the improvements people claim might partly come from improved habits, better hydration, or other cofactors, not solely the drug. What to do if you're considering it? Talk to a doctor, sports medicine specialist, ideally someone aware of both medication effects and athletic demands. Start at the lowest possible dose. Monitor effects, both performance plus side effects. Avoid combining with other substances that affect blood pressure or circulation without supervision. Track objective measures, resting heart rate, blood pressure, recovery metrics, so you can see if it's helping or harming. Be prepared to stop if risks outweigh perceived benefits. Tadalafil has long been marketed and understood as a men's medication, but science is evolving, and now researchers are asking, can women benefit from tadalafil too? The answer might surprise you. The physiology. Blood flow isn't gendered. Tadalafil works by increasing nitric oxide availability and relaxing smooth muscle tissue, enhancing blood flow. And that mechanism isn't limited to male anatomy. In fact, studies have shown that women may experience improved blood flow to genital tissues, enhanced sexual arousal and response, potential benefits in certain circulatory or pain conditions. Research on tadalafil in women. Here's what the science says so far. Sexual dysfunction in women, FSAD. Early studies found that women with sexual arousal disorder, especially postmenopausal women, reported increased genital sensation and lubrication after taking tadalafil. Antidepressant-induced sexual dysfunction, AISD. In women taking SSRIs or SNRIs, tadalafil showed promise in reversing reduced sexual desire and satisfaction. Pulmonary hypertension in women. Tadalafil is used in both men and women with this condition, improving exercise tolerance and quality of life. However, results have been mixed, and many studies are small. What about safety in women? Tadalafil is generally well tolerated by women at low doses, but potential side effects include headaches, flushing nasal congestion, GI discomfort. It is not currently FDA approved for sexual dysfunction in women, and off-label use should always be done with medical supervision. Pattern break. A shift is happening. In the world of women's health, there's a growing recognition that blood flow affects sexual satisfaction, and pelvic health medications like tadalafil may have a future role in treating low libido, menstrual pain, and even perimenopausal symptoms. Some integrative practitioners are already prescribing microdoses of Tadalafil to women, often in combination with hormone therapy. Bottom line, women can use Tadalafil, but it's still an emerging practice. If you're a woman considering this, talk to a functional or hormone-literate doctor. Don't self-prescribe. Dosages and timing matter. Track effects carefully, both physical and emotional. Tadalafil may seem harmless, especially in low doses, but like any powerful medication, it can come with side effects that are easy to dismiss at first, cumulative over time, and sometimes irreversible. Let's go through the ones you need to know about and how to spot them early. Common side effects. These are typically dose-dependent and more likely at higher or long-term use. Headaches, due to vascular dilation, facial flushing, nasal congestion, indigestion, or reflux, back pain, and muscle aches. These often appear within the first few hours after dosing and fade within 24-48 hours. But if they become chronic, they're a signal to reassess your dose. Vision-related effects. Rare but potentially serious, blurred vision, sensitivity to light color distortion, blue-tinted vision. In extreme cases, NAIN, non-arteritic anterior ischemic optic neuropathy, sudden, painless vision loss. If you experience any vision changes, stop the medication immediately and see an eye specialist. Hearing changes, also rare but documented. Tinnitus, ringing in the ears, sudden partial or total hearing loss, especially within hours of use. This may be caused by vascular changes in the inner ear. Like vision issues, this can be permanent if ignored. Psychological effects, often overlooked. Emotional blunting, loss of confidence without the pill, performance anxiety tied to dependence. These effects build subtly but can deeply affect relationships, self-image, and emotional health. Hormonal and fertility considerations may lower sperm motility and semen volume with long-term daily use. Possible suppression of natural libido due to psychological reliance. These effects are reversible in most cases, but shouldn't be taken lightly, especially if fertility is a priority. Pattern break. I thought it was something else. Many users say, I thought I was just tired. I blame stress. I didn't realize it was the pill. That's the danger of slow-onset side effects. They become your new normal until you stop and suddenly feel better. What you can do: start low, 2.5, and increase only with supervision. Track symptoms weekly. Take breaks every few months to reassess baseline. Never mix with nitrates, heavy alcohol, other vasodilators, grapefruit juice. It alters absorption. Tadalafil isn't just about whether you take it. It's about when, why, and how you use it, and whether it truly fits your body and goals. Let's break down the safest and smartest ways to decide when you should consider Tadalafil. Tadalafil may be a good option if you've been diagnosed with erectile dysfunction, ED, and have no contraindications. You're struggling with urinary symptoms from BPH. You've spoken with a doctor about low testosterone or vascular issues. You want spontaneity in your intimacy rather than timing. Pills around moments. You are under medical supervision and monitoring your response and labs. Also, if your performance issues are causing emotional stress or relationship strain, Tadalafil can be part of a temporary solution while you work on root causes. When you should not take it. Avoid or stop using Tadalafil. If you take nitrates or drugs that affect blood pressure, have unstable heart disease or recent cardiac events, experience side effects like vision or hearing changes, severe headaches, unexplained fatigue or dizziness. You should also be cautious if you're under 30 and using it purely for confidence. You haven't explored underlying issues like sleep, stress, or hormones. You find yourself emotionally dependent on it. A smarter way to use it: use the lowest effective dose. Consider as-needed use before committing to daily intake. Track how you feel, not just sexually, but emotionally and mentally. Take scheduled breaks every few months to reset your body's baseline. Combine it with lifestyle interventions. Exercise, sleep, nutrition, therapy. Pattern. Break. It's a pill, not a personality. You are not defined by a pill. Tadalafil is a tool, one that should serve your well-being, not control it. If you feel more like yourself with it than without it, it may be time to ask, what deeper parts of my health and self-worth need attention? By now, you've discovered that Tadalafil isn't just a pill for performance. It's a powerful vascular medication with multiple uses, surprising benefits, and real risks. We've explored how it works, why it's used for ED and BPH off-label benefits like circulation and exercise, its effects in women, and the side effects too many people ignore. Now, the question is yours to answer. Is this pill supporting your health or covering up deeper issues? Used wisely, Tadalafil can be a powerful tool. Used blindly, it can become a quiet trap. If this video gave you clarity, hit like, subscribe, and share it with someone who's considering Tadalafil. Drop a comment. What's one thing you learned today that surprised you most?